Welcome to our weekly 3-minute therapy podcast. I'm Dr. Michael Edelstein, a clinical psychologist and practitioner of REBT, and I'm here with my co-host, Mick Berry, who not professionally, but informally practices REBT. And REBT is rational emotive behavior therapy devised by Albert Ellis in the mid-50s and started a revolution in psychotherapy, which now is largely carried on by REBT therapists and cognitive behavior therapists. And REBT is based on the notion that our emotions come from our thinking about situations, not from situations themselves. And it's a particular kind of thinking that's thinking in terms of demands, must, should, supposed to's, have to's, demands you put on yourself, others, or situations. So if you have an emotional problem, such as anxiety, depression, or anger, look for the must, look for the should, and then question, challenge, and contradict the musts and shoulds over and over and over again. Your preferences make sense. You prefer to do well. You prefer to get approval. You prefer life to go well. But as soon as you make that into a must, then you get into emotional and behavioral problems. Today, we're going to be discussing mindfulness. And we have an expert on mindfulness joining us, Yash Valenkar, and he's in Mumbai and has a website, sipemindful.com. Sipe is S-I-P-E, mindful.com. Sipe, Yash, what does Sipe mean?
SIPE means self-initiative for personal excellence.
What was
self? Initiative. I for initiative.
Initiative?
For personal. P for personal.
Yeah, what's the I for?
Initiative. It's initiative, Michael.
Initiative.
Oh, initiative. Oh, I thought you said initiative. I didn't get that. Okay, so we're going to discuss mindfulness for health. And Yash, can mindfulness be used for emotional problems like anxiety, anger, and depression?
Yes, surely.
So could you tell us a little bit about mindfulness? What is mindfulness and how do you apply it to these issues?
Thank you for this opportunity, sir. So mindfulness is paying attention to present moment.
Paying attention to the present moment?
Yeah, and paying attention to your mind as well as your body, noticing what is happening in your body and mind, and accepting what you notice. So not doing any deliberate thinking and not reacting to what is happening in your mind as well as in your body.
I see. So we as REBT practitioners, we generally deal with some emotional problems I mentioned. So when someone is anxious, what is your view of what's happening in their mind?
Yeah, so when a person is anxious, he has thoughts about basically future danger. It may happen, and at the same time, in his body, he can experience some sensations like heart rate is increased, breath rate is increased, there is some movement in his abdomen. And this is happened because of sympathetic stimulation. So whenever any person notices that there is any danger, our autonomous nervous system, sympathetic system reacts, and because of it, we are in fight or flight mode.
I see. And could you tell us what you mean by danger? You said when someone is anxious, they're anticipating danger. Is that right?
Yes. So that danger can be imaginary or true. So If
So-
a person has phobia about lift, then that lift can be dangerous for that person.
The what could be
If-
The elevator,
Yeah.
elevator, Michael.
Yeah, elevator may create anxiety to a person
I don't
who
understand.
has phobia for
liveter?
elevator.
What is a liveter? I don't quite understand that.
So anything, if anyone has fear for snake, for example, then if he see a snake, he will have anxiety.
Yeah. Suppose I have anxiety about this podcast not going well. Now, from REBT terms, my anxiety would be caused by my must. The podcast must go well. I must not look bad. Things must go smoothly. So we see anxiety caused by must. Now, you're saying
Yes.
it's caused by danger?
Yes. So if I have programming that this podcast will not go what I think was smoothly because I have past experience about it, then I may have anxiety about this podcast.
Right.
And
But
whenever, so that anxiety can be because of reflex action in my body as well as I am reflecting on it. So my anxiety is like a reflex action as well as if I am thinking on that similar mode that this podcast will not be a smooth for me, I will increase that my anxiety. So anxiety is up two steps. First is reflex action and second is because of my thinking. So REBT is very good and very useful to reduce my reflective emotions. REBT is very useful to change my thinking. But REBT is not so useful to my reflex action in my body and mind.
I see.
Because
My
it
view
is
is
beyond cognition.
the feelings in our body, the emotional feelings, not physical feelings, but the emotional feelings come from our thinking. Mick, did you want to chime in there?
No, not yet.
Yeah. So, Yash, how do you see what a person's thinking is with depression as opposed to anger?
Yes, so in depression, there is a triad that I am useless, I am hopeless, and I am helpless. That will be more, and if that person is thinking on that line only, he will be more depressed. So in that case, REBT is useful to reduce that deliberate thinking, but we have two types of thinking process, automated thoughts and deliberate thinking. We name it as a self-talk. So REBT is very useful to do deliberate thinking, rational and logical. But my automated thoughts are beyond my control. And because of that automated thought, there are some changes in my body. And if I pay attention to my body and accept that those changes, I can reduce intensity of that anxiety or fear or anger.
But would you agree that if someone has demands and must, and they change that thinking, then that could dramatically help them get over their demanding thoughts and therefore their disturbed emotions?
Yes, surely.
Yeah.
But I experienced that beyond those demands, there is an automatic thought beyond my awareness. And when anyone practices to pay attention to his own body, he can notice that there are some changes in his body because of that automatic thoughts.
Mick?
Yeah, Yash, you said there is a thought beyond his awareness. I think it's possible, if there's a thought beyond your awareness, to have the thought become part of your awareness.
So,
In other
for
words, you
example,
might not
when
be
there is
aware of a thought, but then you can learn to be aware of a thought.
yes, but when there is a reflex action, for example, if I have a pin or a hot touch to my finger, reflexly my finger goes away. And that is beyond my cognition. It is like a reflex action.
Yeah, that's true, but you're talking about physical pain, and we're dealing with emotional pain or discomfort.
So anger and fear is like that reflex action. Because whenever I feel any danger, without noticing that that danger is in front of me, first my emotional brain will react, amygdala. So now neuroscience has proved that our emotional brain is faster than our cognitive brain. And the mindfulness practitioner can experience it. I am practicing mindfulness meditation for the last 20 years. And now I can notice that the sensation in my body is faster than thought.
Mick was saying that if a thought is beyond your awareness, you can bring it into your awareness. So when I work with clients, sometimes they're not aware of their demands that are causing their anxiety. But then when I point it out to them and they look for it, then they pretty quickly identify those thoughts in their head that was not beyond, that was beyond their awareness at one time. So that's one way to help these help clients become aware of some of these thoughts.
Yes, surely. That is correct.
Yeah. Niraj, did you want to say something?
Yeah. So I want to address one important point. Is one of the objections against REBT is it is too intellectual, where the objection is that people get it, that it is the must and shoulds, but when it comes to applying them in reducing their emotional disturbance, it sometimes doesn't happen. And the counter from the REBTian is that whatever understanding you have is a superficial understanding. So you have to work and practice, and eventually you will able to let go of your must and should. But that is where the mindful has a different view, where it comments that the intellectual understanding is just one part of your overall overall emotional apparatus. So
Yeah.
there are some deeper things. So Dr. Yash, I'm just using Dr. Yash, can you just elaborate on this point? We discussed on this some time back.
Dr. Yash, before we get to you, Vic wanted to say something.
Yeah, Niraj, I've heard that argument many times. What happens if somebody is not finding REBT effective? They're holding on to their irrational belief. They're holding on to their demand. And people cling to their demands. The only way to get rid of a demand is to give up the belief that you're holding on to. And it takes rigorous, passionate refutation of it. And it is actually quite profound to refute a demand, but people's demands are stubborn and people are highly irrational. And in order to change it, it takes persistent and acute practice. I have been, I can tell you, as nutty as anybody can be. I have been as depressed as anybody I can imagine. I have been suicidal. And the way I got rid of my demands was to not cut myself any slack, but to say to myself, yes, I don't like this situation, but I can accept my life and I can accept life in general. Even if I don't like a situation I can't do anything about, it's up to me to accept it. And I am determined to accept my life and accept life in general. It is profound. It works. When people don't think REBT works, it's because they are superficially just saying, oh, I understand it, but they're not rigorously practicing, repeating, getting rid of their demands.
Okay.
Yeah,
Yes.
very good. Yash,
Thank you,
wanted to say
sir.
something?
But I will add that practice is very important, but practice should not be only a thinking level.
It shouldn't be what?
On
only
thinking
about-
level. So you are practicing at cognitive level only.
Well, that's a good point. If I'm afraid of walking over bridges, yes, I want to get over my fear of walking over bridges, but then I also want to put it to the test to go ahead and walk over the bridge. And as I am pushing myself to walk over the bridge, I'm going to have to get in touch with my mental hangups about walking over the bridge. And so I can approach it through my thoughts and the actual behavior of walking over the bridge. So yes, we don't want to just do it by thinking. We also want to do it behaviorally, put ourselves in those situations that we find difficult, that we want to overcome.
Yes, yes. Thank you.
Yeah,
So
and
thank you for this example, this anecdote. Now, whenever you have a fear about walking over the bridge, do you have some body changes? Have you noticed there are some body changes, that its heart rate is increased, breathing rate is increased, there is some movement in your abdomen? Because whenever there is a fear, there is a sympathetic stimulation. And because of that sympathetic stimulation, you have body changes. Have you noticed those body changes?
Well, REBT says that as you change your thinking and you change your behavior, whatever sort of emotional reaction you may have and any sort of feeling in your stomach, that all ends up getting taken care of. And that's what I have found.
yeah, and the body changes are a manifestation of your demands, your musts and
Yeah,
shoulds.
yeah.
So when you reject your musts and shoulds, then you won't have those body changes like perspiration or heart rate increasing, or those kinds of things. So again, it comes from
So,
our
sir, I
thinking.
am curious to know your views about William James, his theory about emotions.
What's his? Could you tell us his theory briefly?
William James, father of American psychiatry, he has theory, William James and Lang theory about emotions.
Yeah, I'm not familiar with it.
What are his theories about emotions?
So there are different theories about emotions, and William James and Lang has proposed that we have body changes first and then we name it as a feeling.
Yeah, that could be, but the first change is our thinking, because our thinking causes our emotions and the body changes and manifestation.
So
If you didn't have, if I just want to finish the sentence, Yash, if you didn't have a change in thinking, you wouldn't have a change in your body.
yes, but I will suggest you, if you pay attention to your body, you can notice that body changes are sooner than thoughts. But you have to practice it to pay attention to your body, and that is mindfulness practice. So whenever a person, so I have one experience to share. I teach mindfulness therapy to clinical psychologists. So one of my student was REBT practitioner, and she learned REBT to overcome his fear about her in-laws. Are you getting me? Would you understand my pronunciation?
Not quite. I have trouble understanding all your
Can I
words.
just interpret?
Yeah, Niraj?
Yeah. So Dr. Yash is saying that he's sharing a story about one of his client who was afraid of her in-laws, in-laws pressurizing her, in-laws kind of being dominant over her. So she was afraid of that, and she was a REBT practitioner. Now continue, Dr. Yash.
By REBT, she reduced that fear. She now overcome that fear about her in-laws. But
She did what
after
to the-
mindfulness approach, she was practicing to paying attention to her body, her own body. And once she shared that, she has a thought that I will call my in-laws, and she don't have any fear in her mind. She was very okay to talk on phone. But in that instance, she realized that her heart is started beating. So there was no conscious thought about fear in her mind because she has overcome it by REBT techniques. In spite of that, she has body sensations of fear. And those are non-conscious till we don't pay to our body. So if anyone is only living in his brain, when anyone is only changing his thoughts, he will not realize those body sensations.
Yeah. Okay, Mick.
Yeah. Now, I would distinguish between awareness and thinking because I agree with Michael Edelstein. We cannot have an emotion without a thought being connected to it. But if somebody isn't aware of their thought, that doesn't mean that there isn't thought connected to the emotion. That means that they are not aware of what the thought is connected to their emotion. And as human beings, one of the things that we can do is we can think about thinking. And REBT teaches people to think about their thinking and become aware of their thoughts. If there is an emotion happening and it's manifested in someone's body, there is a thought connected to it. If a person isn't aware of it, it isn't that the manifestation happens without a thought. It's the manifestation is happening without an awareness, but there is still a thought connected to the manifestation of the emotion in their body.
Yeah, and I help clients get in touch with their thought, their thinking, which they may not have an awareness of first. Well, we just have a few more minutes. So, Yash, did you want to give us a final word and conclude in your message here?
Yes, sir. So I use REBT to teach my clients to do rational, deliberate thinking. So by mindfulness awareness, we can differentiate between automated thoughts and deliberate thinking. And for deliberate thinking, REBT is very important, very useful. But for automated thoughts, if we want to reduce frequency of those automated thoughts, we have to pay attention to our body and notice what is happening in my body because of that thought. And if I accept that thought as well as my body sensations, I can reduce frequency of those automated thoughts popping up in my mind.
Okay, very, very good. Yes, thank you for participating in this discussion of mindfulness and REBT. And just to remind the viewers, you have a YouTube channel called Mindfulness for Health. And I have a website, 3minutetherapy.com, and a book called 3-Minute Therapy. I'm Dr. Michael Edelstein. If you have any comments or thoughts about what we discussed, please add them below and give us a thumbs up if you enjoyed this. Suggest subjects for future podcasts. Volunteer, as Yash did, to be a guest, and looks like Yash survived quite well. So you could do that. Thank you, Chris Rossini, our tech engineer.
Thank you, sir.
You're welcome, Yash. Thanks, Chris Rossini, our tech engineer, for making this all happen. Thanks, Mick Berry, co-author of mine on stage fright, and which shows you how to get over public speaking anxiety and other types of performance anxiety. Subscribe to the 3-Minute Therapy podcast to stay on the rational side of life.